I think as Migori County, we're doing well. And that's the reason why we're even celebrating it here, so that we create awareness, we enhance the partnership to make sure that everyone else is reached across the county. I want to say that we have structures for advocacy, right from the county leadership, county referral hospital, the sub-county hospitals, and right in the community, level 1, we have community health volunteers who, apart from other duties, are also given the responsibility of creating awareness. It's a continuous thing which we do. So in terms of awareness, advocacy, we're doing well. We are not yet there. We must enhance this to move on. In terms of funding, I would say that we fund the programs based on needs. It's a program-based kind of funding and budgeting. However, I want to say that for a while, for a long time, not only in Migori, non-communicable diseases have not been given the attention they deserve. As part of the key things we are doing today is also to advocate and lobby for proper budgeting and proper funding for the same.
For this financial year, previously last year, the funding was not very good. It was only 1.5 million. And out of this 1.5 million, what we received as a division was only 500,000. So this financial year, we've worked on our AWP. AWP is annual work plan. So annual work plan has been allocated. We have been given a ceiling of 3 million. But 3 million still is not enough, but at least we are moving forward. So the main cause of hypertension around this region is, we are living in an era where people don't like exercising. We like life of inactivity, where we like moving in vehicles, motorbikes. We don't like walking. Then another thing which is killing us more is our diet. How much salt do we use? How much oil do we put in our food? And how much proteins do we take? How much portions of carbohydrate do we take in our meals? So that is what is killing us. And then another thing is harmful use of alcohol. There's a data which was released, I think, by Kenya Indicator Survey, which was showing alcohol is the most abused drugs in this region. So about more than 46% of people living in the Migori County abuse alcohol. And that per se can lead to a cause of hypertension.
We have primary hypertension and secondary hypertension. Most of the cases we have caused by primary hypertension. So these are issues of lifestyle modification, which is part of the first intervention we are doing. For instance, in this camp, we are doing a screening. So the first thing we are doing is trying to talk to the patients in terms of how they can modify their lifestyle to reduce their numbers. So when that fails, we now proceed to the medical interventions and monitor them and our special clinics throughout their life for the period that we are managing for hypertension. The numbers are varied. In Migori County Referral Hospital, we have the biggest number of cases of hypertension. That's patients who have been registered and are currently undergoing scheduled checkups every month or 2 months, depending on their progress. Awendo also has a clinic which is happening every Wednesday for chronic illnesses, hypertension being one of them, and diabetes. Rongo, Isebania, and Kehancha, together in Natike, are also having the same kind of clinic. So I think in terms of care of these patients, we have the structures in place.